So I'm Paul Elkington, I'm Professor of Respiratory Medicine at University of Southampton, and I'm a consultant respiratory physician at Southampton General Hospital. And before coronavirus started, my main interests in life were tuberculosis, which is an airborne infection, and seeing patients with tuberculosis and doing general respiratory medicine on the wards. We were having training in donning and doffing, which is putting on and taking off personal protective equipment, and it was so cumbersome and user-friendly and wasteful, and it all looked like it would run out within about 2 months. And so the idea of the personal respirator came to me one day when I was driving to work, and that morning I sent Hywel Morgan an email saying, "Dear Hywel, is it possible to make respirators from cheap and locally available components?" And that's how the whole PeRSo project started.
I'm Hywel Morgan, and I'm a professor of bioelectronics in the School of Electronics and Computer Science at the university. One of the challenges, in fact, was not so much assembling the fan and the filter, but how to create a hood system, which of course we were unable to buy, from simple components, and construct something that will feed the air through the hood down across the face. We were lucky enough to be in contact with McLaren, who have a great team of engineers, and they helped us to design some very simple, easy to put together hoods and air diffuser systems. And this is one example here. It's very simple. It can be 3D printed or cut from bits of plastic, and you see very easily how you have a piece of hose, a holder there, which goes in, and that goes over somebody's head, and this connects to the filter. We've got this belt here, it's a bum bag, batteries in there, fan in there in a nice container, bit of duct tape holding it together. There's the filter. There's the pipe and the hood assembly, the air diffuser in there in green, and you can see how this works. There's a tie string at the back, and actually we were able to take this up to the hospital on that Thursday and do the very first tests with the clinicians and the medics to get feedback on how this felt, and actually if it performed the same as, or in fact better than, the current PPE masks they were wearing.
It's been a brilliant project to work on in terms of the interaction with all the engineers who quite often have worked till 2 o'clock in the morning to optimise a prototype to then bring to the wards at 8 o'clock in the morning for being testing. And as a team they've been amazing. It feels much safer and indeed gives much better protection than a surgical face mask, which doesn't give you any protection against airborne infection. And there are over 1,000 in hospital use at Southampton General, and this is only 7 weeks from that first email being sent. And we have those on the wards from the 5th week, and they've been gradually being rolled out. And within a couple more weeks we should be having 5,000 in use in the operating theatres.
Everybody thought it was the best thing since sliced bread. I think we all recognise that this respirator has a significant role to play, at least in the medium term. It has uses not just in medical fields, but in veterinary and dentistry and people working in high-risk occupations. We're very grateful to the Southampton Coronavirus Response Fund for their contribution to this project. Without that fund, I think we would have been considerably less able to proceed at the pace that we did, and to deliver those prototypes in that tight timeline.
When we first started rolling them out on one of the G-level wards, one of the healthcare assistants came up to me and said, "I've been feeling sick with nerves every day I've been coming to work, and now I've got my respirator, I feel safe." And for me, it's all been worthwhile from that.